is to talk about, let's start, y'all, so we can just get out of here. So, the first thing I want to talk about is a culture. Anybody here, we do culture and spiritual today, okay, but is it recording? Did it go 1, 2, 3? Okay, 3, 2, 1. Okay, so the first thing I want to ask, anybody in here have any, like, cultures that they follow? We'll talk about spirituality in a little while, but what culture, I'm just talking about culture. Like, I'm Italian, we have certain cultures. We just did the St. Joseph's altar. And yeah, you did? Okay. Catholic, well, that's a religion, but you do have culture from the religion. Like what kind? Okay. Okay. And what is that called? We're going to talk about that in a minute. Assimilation, acculturation, things like that. Anybody else? The first son of the day? The first. Oh, you mean son? Oh. Oh, you mean a son like S-O-N son. I thought you meant like in the morning, the first son that you say is the most important. I know somebody that prays on the sun, like that as soon as they see the sun rise, that's their prayer and meditation. That's all right, I just started. We're just talking about anybody had any cultures and stuff. Yeah, that's spiritual. We're going to talk about all that stuff. So to care holistically, the nurse should integrate culturally congruent care, right? So you have to know about their culture, and that's what we're going to talk about today, all right? And then in the U.S. right now, you know, there's a lot of cultural diversity. There's more cultural diversity when I grew up. You know, of course, I'm older. I grew up in the 70s, and now it's evolved more through the 90s, up into the new millennium, up in this age in 2000s. You have, in some areas, you know, they have more dominant variations of culture patterns. We'll talk about the culture in this city and around here also. Okay, so, let's see, I always skip that. Okay, so culturally responsive care, it just means that you're providing care centered around your patient's culture. Okay, they might not have a specific culture, but if they do, you need to recognize it and you need to be able to implement it into your care. All right, that's all it's saying. And it's whatever their values and beliefs may be. It also talks about integrating patient's values and then developing a self-awareness of your own culture. So just like with spirituality and culture, as soon as you know your own culture and your beliefs and what you believe in, you can better assist the attitudes and the beliefs of someone else's culture, a patient's culture. So you can examine your biases and create an environment that's a trusting relationship. You'll hear me say some of the things I said in communication because it kind of goes together a little bit. Because when you're communicating, it's a lot of communication with culture and spirituality. It's not so much a physical thing, it's more a subjective thing, right? So the definition of culture, there's all different ones. This is just some of them. It affects how people view and evaluate their lives and experiences. The members of the culture group share their values, the way they think and act. I may not think and act because of my culture and the way I do, like specifically like you, like some of y'all take your shoes off before you go inside. We don't do that. You may, like we talked about the culture of having the St. Joseph altar. I'm Catholic. I'll talk about that a little bit. I'll talk about how different things about my religious experiences and culture and how it integrates with what goes on with my religious beliefs and with health, okay? So an example is my family had brought over statues and different heirlooms and different things from Italy. I'm a third generation out from Italy, so those statues and things that were my great-grandparents, I have them in my house. Blessed statues, things like that. We pray with them. That comes into spirituality. But it kind of ties into my culture, okay? So that's an example. Does anybody else have an example of what they may do for their culture? We talked about taking your shoes up. Anything else? Y'all do foods are kind of a tradition, but it also comes in as a culture. You know, culture is broad aspect experiences. Come on, y'all, my talking class. Y'all don't have anything? Nothing? Well, maybe as I talk along, I might give you, don't be afraid to share. Anybody want to share? Well, yeah, that's a tradition, but it also brings from a culture, for whatever culture you came from. like whatever we do for our holiday, because we're Italian, we do, but we always have pasta with our food. So that's a culture that comes in as a culture, but it also becomes a tradition. Okay, so it makes sense. So as I'm talking, you may be able to realize some of the cultures you have. So let's see what else. So members of the culture, the way you think, and the way you think may not be the way your patient thinks. And we're going to talk a little bit more about that. These are just your vocabulary. I know you had them up there. This is just for you for practice to know. I'm not going to go through them. It's just a little exercise I gave you before class. And you just have to understand these healthcare language to be able to implement them into the concept and also for testing purposes. So health disparities. So what happens when you despair? Well, you can look at it where the population is different from the next population. What one population believes in, disparity is not so much as the other person. So it's the differences in compared experience from one population to another. It also, disparities can mean like maybe someone who provides, who their care may be poor for the health. They have a greatest risk because of poor health. Demographics, this slide is just like an FYI. Demographics, the Census Bureau in 1960, anyway, I wish it was. The 2060, that Hispanics and Latinos represent 31%, and the total population in white non-Hispanics will decrease from 63 to 43%. What they say in these, all these research and demographics and statistics saying that in the year by 2060, everything will be equal. There really will not be any majority. Everybody will be pretty much in an equal base. So then we just talked about immigration just a few minutes ago when I was asking y'all when it came in about cultures and different things. About immigration is both, it affects you and it affects the culture. Both cultures are affected, and it's traits from another country or another place, another area where you live. So assimilation is an individual that develops a new cultural identity, learns ways of the culture. Like you said, you took your shoes off before you came in. Well, that's something that you learned from living in different places. How many places did you live in?
We were in Japan for a long time. Like, we celebrate Golden Week with the kids.
Uh-huh. So you assimilated their culture, and then you brought it here and you still do it. So, you find people, patients in hospitals, and when you care for your patients in other healthcare settings, they'll have assimilation traits. Also, acculturation is incorporating traits from another culture, which you've done that too. And it's a lifestyle of their own culture, and you move into a lifestyle of another culture is what usually happens. So I may have a lifestyle of maybe just something as simple as I didn't eat my breakfast until 10 o'clock in the morning in my culture, and then now I live here in the United States and everybody eats early in the morning, everything's fast-paced, and I have maybe more of a laid-back culture where we didn't have 10 and we only 2 when we had tea in the afternoon. Well, now I eat my breakfast at 6 o'clock in the morning. So from, so I use an acculturation and an assimilation in combination of learning the ways and acculturation of learning the ways here. So it's just 2 definitions for you to understand of how people that are coming in from other areas and other diverse communities and countries, how they have to assimilate and acculturate to the United States, or if you go to another country abroad. Oh, did it go past? So health, tradition, and model. This is just one example. There are many in your book, and this is just one example I gave, and I just want to talk about it briefly. It just shows that researchers do, and they have these people that go in and do research. You probably read a lot of it in different areas in your book, where they have different people that do research and do models. And this is just one. I want you to just be aware there's different culture models in nursing, for nursing, all different types. So this is a health tradition model, and it just says that in this model, it just is the traditional beliefs in patients that have existed for many generations without changing. We discussed the concept of holistic care. We described what people do to maintain and protect and restore health. And that's all it's saying. It describes health and balance of a body and a person. So that's what this model is talking about. And so you can go to your book and read all the different models. Okay, so you know that researchers have done different and have incorporated different healthcare models for different cultures. So these are our little health beliefs, and these are examples of beliefs and practices. And the eggs up here are from China. I'm just going to go through them. It's just for your own knowledge. You may see some of this in the hospital. I know the Hispanics believe to heal, you put eggs under the bed, so you might see an egg under a hospital bed or in a clinical area or in after surgery and post-op. They may carry the egg with them. Some of them carry it in a napkin, and they'll just hold it behind the bed for a short period of time for the patient. They won't leave it under there. So this is just little eggs also from China, and it's to restore health. And then this little red ribbon is from Israel, and it's for physical health. These are herbs, and usually from Africa. This restores mental health. It's like a little tiger balm that you rub in the palm of your hand. And it's from Singapore. They use that to restore mental health and for spiritual health. And these are rosaries. People have probably seen that around here. And that's for spiritual restoration, meditation, prayer. What is the eye? The eye is from Cuba, and it is mental health. And it can be hung in the house, in the home. So maybe when you're doing home health, you may see some of these things, and so you know what they are. This over here I saw not too long ago, this pendant. It is from the Hopi Nation, and it's for mental health, and it means good luck. And I saw someone wearing it. I seen it in the grocery store. A gentleman had it on, and I thought that I put this slide up a couple semesters ago, and I was like, oh, look, this is, I just put that up. So it means good luck and good health. So this just gives you some ideas of things that people do. I mean, I'm Catholic. I have rosaries and beads. We pray. Well, oh, wait. And then the one in the middle is just a generalization of just nature. And it's supposed to restore and revive your health as holistically. You know how when you go and you're in clinical all day and you walk out and you get the fresh air and just around you, doesn't it make you feel like a little bit better? And then maybe that afternoon, just to de-stress yourself, or when you're studying, you go walk in the park and you may sit in an area and study. It just makes you feel a little bit better. Yes? No? So that'll help you. So that's just a holistic one for every type of need of meditation or whatever. So health beliefs, let's see, skip the page. For this different health beliefs, you'll see these, and you'll probably hear people say some of these things. For the magico-religious, it's supernatural forces. So what they say is they blame God. They say, let me retract that. They don't blame God. They feel like they sinned and they did something wrong. And since they sinned and they did something wrong, and they're opposing God, the supernatural forces made them ill. So it's either God or supernatural forces that made them ill. And they feel like magic causes the illness, evil. And then the scientific biomedical is more physical control, manipulation of human illness. And that really correlates with what we know. You know, we go in, we get sick from some type of biomedical scientific illness. The illness causes by germs and bacteria, and then we heal it by treatment and antibiotics. Yes.
On the flip side of that, I've had my father's sister, who's 53. They grew up in the Church of Christian Science.
Yeah.
And she developed metastatic breast cancer. And based upon their religious
right.
She chose not to pursue any treatment at all.
Right.
With prayer. As healthcare providers and nurses, how do you handle that kind of situation?
We're going to talk about that in religion. We'll talk about it now, but really what happens is all you can do is just listen to what your patient says. You're an advocate for your patient, correct? So you have to just go with their wishes and what their beliefs are. You can get other healthcare providers in there to maybe show them options of what can happen if they don't get this treatment or that treatment, but basically it's up to them, and you just do a lot of good documentation. And, she doesn't... Right, blood transfusions. If you don't want blood transfusions, that's another thing we talked about earlier this morning. You cannot do anything but document. You have to document, so if insurance companies or someone says you didn't do the right care, it shows that we offered this support, we offered this help, we offered this treatment, and there was nothing that they were opposed to all treatments. So that happens, and it does happen. And some people believe with cancers and all. My sister-in-law, she got breast cancer. I told them this morning, and she had a part of her breast removed, and then she did radiation, but she didn't believe in chemotherapy, so she did a holistic care, and she did like she ate clean, and she did that oxygen therapy, where you go into the oxygen chambers, and then she did a lot of meditation, yoga, and she did herbs and stuff. I think Suzanne Summers, she wrote a book about it. She had breast cancer. She did all herbs and natural products, and she doesn't have breast cancer either. My sister-in-law doesn't. It's 15 years ago. But she did receive radiation. Yeah. But so it depends on it also depends on the cancer and what's going on in your body, I guess. But, we're going to talk about that in spirituality, and your mind is a positive entity in your body. So then you have holistic care, which is the forces of nature maintain a balance and an off balance, the yin and the yang. And then you have folk medicine. Well, a lot of people still practice folk medicine. And folk medicine is practiced a lot in this culture. In New Orleans, they believe in a lot of herbs, spices, voodooism, folk medicine, things like that. So you will have, it pretty much will take place in your community. One thing, so I was thinking about, is also you got to make sure that when you do a good assessment on your patient, if they're taking herbs, so they may bring herbs with them, no matter what it is that they're using. They may believe that it's going to heal them faster, quicker, be powerful or whatever. You need to document that, and you need to let the physician know, because they have to know, because it will interact with the medication, correct? Okay. So this right here is just culture health related practices. This is just examples I'm giving you of different scenarios with different type of cultures. And it doesn't mean that just because you're taking care of an Asian patient that they are going to use these different types of examples, but they may use something different. It's just opening your eyes to know that everybody uses different practices of health. So the Asians, if they have a fever, they believe in wrapping themselves up in warm blankets and giving them hot liquids. And actually, a long time ago, when I was growing up, you always put blankets on you. Now they tell you not to. But you know what? If you're in the hospital and you have a person come in and they have a child, say, and they want to, now they say take all the clothes off the baby or the child or yourself, or just something light, and take the blankets off. Well, if your belief is, or their belief is to keep the blankets on, then you have to abide by what they want and their needs and their wants, and just document that that's what they said they wanted to do. Okay? Documentation plays a big part in this when you have patients that have other beliefs. African Americans, they have herbal remedies. They believe in lactose intolerance, that herbal remedies may contraindicate with prescriptions. We just talked about that. And dairy products may cause lactose intolerance. And it does to some people. And then you have Native Americans here. Some Native Americans are very resistant to weight loss, mostly women. And then they also believe, the males don't believe in circumcision. Well, it can conflict with beliefs. And then the Hispanics, they like hot and cold foods. Earlier I had a girl, but she was not Hispanic. She was from Africa, and she said that after she had the baby, she could only have hot things. Anybody ever heard of that, or is that true? Did you have a baby, you only had hot liquids, huh? What's that?
Yeah, I know somebody.
Yeah, but she said that she was so thirsty that all I had was ice chips. So after she had the baby, she had to take the ice chips because she couldn't take it anymore because her throat was dry. But after that, she just had hot liquids. And then Asian and Hispanics, they families may not share the illness with, especially I find with the Asians, they may not share the illness with the elders. They may just, what they may do is keep it within the younger generation of the family, but then that hinders what they have to get hospice care or whatever, because the elders don't understand why they have to have that type of care, because they think everything is okay and they haven't been actually communicated with. So you got to make sure they communicate with them and, actually have the wishes of the patient also. Remember, you're an advocate for the patient. So those are just some examples. On box 18.2, you can look at much more examples. Communication style. So for communications, for verbal communication, you have verbal, which is an interaction a person does not speak. So if you have a difficulty with communication, you would get who? A translator, right? Sometimes they will have family that will come in and translate. Sometimes another nurse can translate. They're bilingual. If not, you can get the translator in there. You get the social worker in there and have them come in and get a translator. When you speak to them, though, the patient, if you do have to translate, always look at the patient. Don't look at the translator, and make sure that you speak with that patient to make them feel like it's about their care. It's not you and the translator. They won't feel like it's about them. Also, we have nonverbal communications. With nonverbal communication, you have to watch the facial expressions. You have to watch your facial expressions anyway. Remember when we had, we talked about communication, about facial expressions, nonverbal communication. You have to do the same thing. You have to make sure that, whatever you believe and whatever you think is not necessarily, you're not going to make a face at what their decisions are, or what they like is not something that, if you dislike it, that you're not going to make that facial expression. Also, remember we talked about communication about space, personal space. Sometimes when you're communicating with the person, some cultures do not like you to get really close with them. So you need to learn about that culture. If you're taking care of a patient of that particular culture, some people will not look at you. They will look away. That doesn't mean they're not listening to you, but they're hearing you, but they do not give you good eye contact, so that's okay. That's their culture. You need to know about that. Let's see what else. Also with like Indians, that's another thing. With Navajo Indians and different Indians, they talk about past time, that they're in a past or a present time. African Americans are usually on their present time, and Europeans, they plan for the future. They're always looking for different things they're going to do in the future, like vacations and things like that. So when you're helping your patient plan their care, someone, maybe a European, would be thinking about, well, I'm sick now, but I'm going on a vacation in June. Am I going to be able to go on the vacation? They're thinking about what they can do now to get out, where an Indian may be thinking about what's going on right now. And then, you'll have your African Americans would be the present time, or what they want to do now, the important, what they need to do to fix their schedules right now. And then the Indians would be the ones that would be thinking more of the past. So you have to take all of those things into consideration. I also have on the back, I wrote some just little examples, that Eastern culture, they're pretty quiet. Where that's, like Asians, that you find them rather quiet. A Western culture is very loud, and they like noise around them. A handshake is okay in the U.S., but for Native Americans, it's a sign of aggression. And then a European likes direct eye contact when you're talking to them, and then the Asians avoid eye contact. So just some more examples. So when you're in the mix of the hospital and all, even as a nursing student, you know what to expect a little bit. Okay, touch and eye movement. And make sure with touch, just like with communication, you've set a rapport and you know whether or not you can actually speak, touch the patient and what your parameters are as far as space orientation. Okay, so to provide culturally congruent care, your goal is the nurse must know their culture knowledge, acquire their awareness, their skills, and what they know, and then they can better implement them with the patient. Okay, and then you have, if you cannot do that, then you're going to have conflicts, and it may not be possible for you to set a rapport and provide competent care. So competent care is just saying that you're giving them the best care that you can offer them. So what are we going to do for nurse management? So for nurse management, you're going to look at the patient. You're going to identify your own culture and beliefs like we just talked about. You're going to also, you want to convey a culturally sensitive environment for them. Things you want to make sure that you earn their respect and they've earned your respect, right? So you want to be respectful. So when you would walk into the room, first thing you would do is you would address them by their full name, okay, by their last name, preferably. When you introduce yourself, you're going to introduce yourself with your full name, okay, because you don't know if they're from a certain culture, whether or not if you enter the room and call them by Mike, they may be offended by that. So always be careful and just really should address anybody by their last name at first and then give you your full name. Okay, and that shows respect, it shows support, and you need to consider, like it says here, what patient thinks about their health, their problems. You're going to look at how they feel about their culture and their awareness of what they really like and what they really want as far as their culture and their health. Okay, so, whoops. What you're going to do next is you're going to do your assessment. So when you're assessing the patient, okay, you're gonna ask certain questions. Do y'all have any idea what type of questions you would ask about them, to them? What about their family? Any questions for assessing? If you walk into the room and you see herbs sitting on the, I always tell my patients my students, when you go in the room, remember I told y'all this, look at the room, look around, see what's in there, and see maybe they may have something, some ritual, something that would be out of the ordinary, or you might have the family talking to them about some type of culture, diversity, health issue they may be having. So you may listen, you may be able to hear it, but the family members talking, you may see something like a statue in there, or some type of symbol in there like we talked about, okay, that I showed you earlier. And so what would you do? Maybe you could break a conversation out about that, or what is this, or I have one of these, or I've seen this before, and can you tell me more about it, right? That's just like a good communication, and once you do that, you set that rapport, you're talking to the patient, and they're open, and then they start telling you about their culture, and they'll start speaking to you about what their needs are, and then from there you can say, okay, well, how do you feel about that as far as your health issues? And then can talk to you a little bit more about their health issues, okay? So, and then how they incorporate it with their culture. So you need to identify traditional cultural heritage. That's basically what that means. So you want to assist and facilitate them. You want to enable that the patient to make a discussion about their current illness, and then how does that illness and their culture go together, basically. Then you're going to do a diagnosis and set a goal, all right, and then you're going to do some planning. And with their planning, you're going to be aware of their own culture and heritage, and how competent they are. And some patients may have a certain culture, but they may not practice anything in the culture. Some patients may be, they may have a culture, but they know that, like we were talking earlier, if they don't take this medicine, even though they normally don't do it, they won't get better, especially if it's an illness they really want, that's something that's not completely terminal, but very serious. They know if they don't take the medicine, they're not going to get out of there, they're not going to get better. They may do it, even though it's against their culture. So you have to know all of that, what's going on with your patient. You're not just walking in there, giving meds and walking out. In other words, you need to find out. And then they may not take a certain medication, where they may want a high blood pressure medicine, but they may not want to take something for their, maybe, sometimes they're giving them something like a Zantac or a Pepsid or something like that. Or a Prilosec. They may not want to take that for their stomach. They may have some herbal teas that they drink, so they may refuse it. So they refuse it, you document it, and then, you write down what they prefer, and then you let the doctor know, and if it's okay, they can have their herbal teas for their digestive system. So it's all a lot you have to encompass when you're dealing with different cultures. Okay, so their tradition, their health traditions, talked about that a little bit just now. And then you want them to adapt where the patient is made to be able to live in another culture in their room. In other words, if they're in the environment of a hospital, you want to make it comfortable enough. If they're really culturally diverse, like for Muslims, they turn the beds a certain way. So you want to make them feel comfortable in a culturally diverse atmosphere in the hospital. Does that make sense? Okay. And then you're going to plan and incorporate their beliefs and their practices. Not what you believe, but what they believe. And then we're going to go on and implement, so you have culturally preservation and maintenance. If the patient chooses to follow their own culturally practices, we just talked about that. Where you would implement whatever their practices are, and then you would adjust their goals accordingly. So when you do your evaluation, of course, and y'all been doing your plan of care, right? Everybody's been doing a plan of care, and everybody understands that if their evaluation is not met, they need to go back and follow the goal, right, and the outcomes and see if they've been met. And if not, you have to maybe adjust your goal, or if they have been met, everything's okay. You can move on to a different plan of care. And if they haven't, they need to go back and adjust it and maybe adjust their own interventions, right? And implement their own care. So if they're not achieved, then you need to be active enough and activate and achieve and consider whether the patient's belief and systems have been adequately met. Okay? So a lot of it goes with communication, you guys, and has anybody in here actually dealt with any culturally diverse patient? Very culturally diverse yet? Go ahead.
We lived outside of Detroit in Dearborn, Michigan, and I've mentioned this before, huge Muslim population. The hospital would actually put prayer rugs in the chapel. They would sound the call to prayer overhead. Patients would get prayer rugs in their rooms. The beds would face mat on, that kind of thing. But we would encounter a lot of issues when they would come into the emergency room. It would be an acute situation. They would need help right away, but the males would refuse to allow female family members to be treated privately.
Okay.
Treating with heparin, if it's derived from
The pork, yeah. That's another thing.
they would refuse treatments with things like that.
It's
So
interesting.
it really kind of threw a wrench into adapting care to treatment.
Right. And so you do have to adapt care. And another thing is that if you get, you list the patients for that day, and you might get a new admit, and the night nurse gives you a report, and you don't know anything about this culture, so simply just go read about it, find out, and then communicate, and then go in there and talk to the family, talk to the, see how much their culture is implemented into their health, by, like I said, go in and look around, see what's in the room, if nothing's in the room, just strike up a general conversation, and they'll start talking about it. They will. They'll tell you things about themselves, and as you do over the course of the day, then you can implement more care and do a plan of care with them. Okay? Anybody else have anything to share? Right.
At first he questioned heat, ice is better than no. We don't do ice, we do heat, and so put heat on him instead.
Right. And then you have, so what do you do in that situation? You just agree to it, that's what they want, and you document. Make sure you document it, because they may come back and say, well, this happened, but they didn't want the ice, so it's documented when they go and read what's going on. So that's one of the most important things when you're dealing with culturally diverse, And a lot in this area, in this area we have how many different cultures do you think we have here? Many. So it's not like where you were, which just like an influx of, that just a Muslim. Right, it's a lot of different cultures. So like I said, that would be your best bet. Whoever comes into the hospital and you don't really know. Your main ones, you have your Asians, your Hispanics, what else? Vietnamese. You have a big Vietnamese population, especially in the East. And they're the ones that won't give you eye contact. They're the ones that won't tell the elders about being sick. And so I had one time that didn't tell them that they were sick and they had cancer and they were dying, and they thought they were just in there for a routine test. So but it's up to the family member to tell them, and so there's not a whole lot you can do for them. But so, y'all have any other questions or concerns? Because this ends culture, and we're going to go into spirituality. Okay. All right. So it kind of marries each other because some of spirituality and culture go together. Okay, because if you have like as far as some cultures interrelate with spirituality, I guess I should say, because as far as like it's a culture, I use mine. We had St. Joseph's Day, and that's a culture, but it's spiritual. Okay, so that's a really good example of that. Everybody thinks it's about it's celebrating St. Joseph, and that's what we believe in the Catholic religion. Okay, and everybody just knows it as getting cookies, but it has a lot more meaning to that. Okay, and for us, and for the Italian descent, I'm third generation. It's not that long ago, my family came from Italy, and so we still have a lot of cultures. We have another thing we do before getting spirituality. We have pasta with a lot of our dinners. My grandmother, we had pasta all the time, and it didn't matter if you could have red beans and rice, but we had spaghetti with it. We had a pot of spaghetti and gravy, and that's why we all have weight problems. But we don't do that so much anymore. But at big holidays, for Thanksgiving, we have lasagna and we have manicotti, and a lot of people don't do that. That's all noodles, Italian dishes, and then artichokes and things like that. For Christmas, we started having meatballs and spaghetti because that's what the kids wanted, and busciolona and ice cream and spumoni and all that stuff because that's what they wanted, because that's how, it's a tradition, but it's also brings down a culture. They'd rather have that than the same old traditional Thanksgiving dinners. But anyway, so you probably if you think about it, you probably have some type of culture that you have that's happened in your home or whatever, and that you bring down, with you. Okay, so spirituality. So spiritual health. So spirituality is awareness of one's interconnection with oneself and with a higher being, right? Well, we're going to talk about a difference between religion and spirituality. And then a person's health depends on a balance. You usually need to have a balance on that, and if they have a good balance between spiritual health and their own beliefs, pretty much they will be have a good positive attitude, and they can go along and heal faster lots of times, or heal better, quicker. And then also spirituality is important because it can maintain their health. So under spirituality, you have mind, body, spirit that's interrelated, and that's pretty much a holistic care. So we encompass all of these. Mind, body, and spirit when you talk about spirituality. The physical and psychological well-being that results from beliefs and expectations. So my beliefs of spirituality may be a little bit different than yours, but I still have a good spiritual health. And the health outcomes can be positive when they are able to exercise their spiritual beliefs. So beliefs and convictions, that's what it means to be powerful, for their resources for healing. So my spiritual beliefs are very strong, so my beliefs in healing are very strong. An example in my family is my husband's side of the family. His uncle just got diagnosed with cancer. A year ago, they kept saying that he had problems with his blood sugar. He kept having hyper and hypoglycemic attacks. He went to the doctor, said he was a diabetic, put him on all this medicine. It was still fluctuating, still wasn't getting better. He started losing weight. Did more tests. It ended up he had a mass on his tail of his pancreas, which is the tip, which is better than having it interrelated inside the pancreas. And you'll learn more about that later on. But so what they did, it metastasized because they waited a year before they really kept saying he just was a diabetic. And so it went to his lung, and it metastasized, of course, into the liver because all the GI, everything's so close together. So, it was just like the power of prayer and in our family, and we all prayed. And I know it has to do with chemo and the drugs and all that, but just his mind and his thoughts and the positive energy we were given to him, our spiritual energy went to him because it went to him as far as, through my aunt too, Gary, my husband's aunt, but she's like my aunt, through my aunt too, because, that positive energy, because she's the caretaker, because you got to pray for the caretaker too, or give spiritual energy because they're worn out. And, 6 months later, he has, all of it's gone, and he has only It was 4.5 centimeters, and it's less than 2 centimeters. But and he lost like 25 pounds. But I don't think that he would have gotten through this, and he was already he was a small man, so he's like 160 pounds. And now he's actually this morning, he was like 118 pounds when I went and saw him last week. But he's got that positive mind up there. But if you put somebody in a room and you're negative and you're having all this spiritual distress, you're not going to heal as fast. I've seen it so many times. And probably people in here hopefully you'll be able to share of different patients or different family members that that if they have a positive outlook on their health, it'll be a positive attitude. This morning, I had a student say that she prayed with one of her patients yesterday, and she got diagnosed with cancer, and she was young, and the cancer was everywhere, and they only thought it was going to be in one area. And she sat and she prayed with her for like 25 minutes yesterday. And then she went back in there and prayed another. And she said she cried with her and everything because she was only like 30-something years old. But she said she was real positive and real upbeat. She had a real upbeat family. And she just got told yesterday, and she said that they would, just pray and have, meditation and so she said, she told, I don't know her name, but the little girl that was in here earlier, and she said that, that they will probably have a good outcome because of that spiritual praying and things like that. So, more positive you are, the better it is, I guess. My son, I'll tell you another story real quick. My son's 39, and one of his friends that he grew up with through high school and college, he's 38, and he had a whole group. There was a group of them, like 12 or 13 of them, all went to LSU, graduated. Now he's 39 years old. He has his friend has a beautiful family, and he just got diagnosed with lymphoma. And it's in a bunch of places, and not everywhere in his body, but a lot. And that was like 2 months ago, and he's been through some treatments already. Actually, he's a principal of a school in Baton Rouge, an elementary school, and he's on sabbatical. But he just had his last baby. He has one 5, one 2, and one 4 months old, 5 months old. All girls. And beautiful. And, my heart just goes out for him. They're doing a big fundraiser for him in June. And he's going to be in treatment for a year, they said, at least. But he's already, they did a PET scan last week, and they've already conquered some of that. But the power of prayer, they're a real strong religious family, and that prayer and just that positive outlook will get you through a lot. It'll get you through a lot more. Okay. That's my stories. So, anyway, spirituality, huh? Yeah. Yeah.
We were talking about that. There was a study done, some scientists actually did a study on patients that actually had prayer and spirituality part and those that didn't. And he found that the patient that was the critically ill patients that had the positive reinforcement with the prayer and meditation, they actually did better and lived longer.
There you go. That's right. And y'all, this is Miss Neely. She teaches the 4th level. Maybe you're lucky to have her at your clinical. She's in here sharing with me today. She teaches culture in a higher level. Thank you.
So when you have patients that don't have support system, a lot of times I'll have the social worker or
right.
Neutral minister if they're not really to certain things, kind of give them some maybe resources, support group, because it's the ones that don't. They're unmarried people, people that are very spiritual, those kind of things. They do a lot. They have, like they said, a better outcome.
Right.
It's mind over.
Yeah, because look, it is. Mind, body, and spirit are interrelated. Yeah, Mrs. Strunk, thank you. It is. It's true, and it's so true. That is. I've seen it. I've seen it with my aunt. Remember Miss Strength that was diagnosed with cancer at 58. She lived till she was 70. Inoperable cancer. And it was mind and spirit. Very religious and prayed every day. And she prayed, she wanted to see her grandkids get older. And not that they got married, but they were, I think, 15 and 10. And she wanted to make sure that they always remembered her. And so she lived, and they remember her, and we talk about her all the time. And I'm with them, I talk about them. So, it's mind over and spirit and spirituality, all the way till she passed away. But right here, most humans, they want to be able to seek a transcendent self. They want to be able to have a meaning and a purpose. Everybody in here wants to have a meaning and purpose in life. It's just something that's instilled in you. You want to have a connection, and it may not be with prayer or religion. We could talk about that. It might just be that supreme being. So they may not be involved in a religious structure, but they still will have that supreme being or something higher power that they look up to. So religion is more like organized. It's more like in the community. It's a community base where you go somewhere and you pray, like a synagogue or a church or something. And you have a collective. You may have that study of the scripture, like it says here. And they perform rituals, like I go to church every Sunday, things like that. And then this is just two definitions we have by the agonists. They believe in the existence of God, or a person who believes in the existence of God, but it's not proved. And then the atheist does not believe in God at all. So this is just a religious and spiritual belief. So religion is helping the patients maintain faithfulness, or it's a belief system, okay, and a worship practice. Where spiritual care is to identify a purpose in life, a meaning in life, something that's bigger, like I said. They have a relationship with a higher being or a force. One of my sons, he doesn't go to church. They married a yoga guru, and she believes in yoga, and they meditate, and they believe in Buddha, and Miss Dress is laughing at me because she does. And all of those other, which is nothing wrong with that, but they believe in that higher power, and they believe sit out in nature, and namaste, and everything, but that's what they believe in, and hey, there's nothing wrong with that. They believe in that, and that's what they meditate on, and that's what they pray on, and whatever gets you through the day, if that's what you feel. If they get sick or something, that's what they do, and it works. It's just a positive mind and body spirit, and that's what you need. Okay? It offers connectiveness to the inner self. So this is just to know the definition in between when caring for patients. The nurse must understand the difference between religion and spirituality. So which one do you think is religious care that helps individuals? A, because a belief system and worship practice. The other ones would be spiritual because they develop a higher being, a culture connectiveness with the purpose, and a balance. And you can have all those things and have religion. So religion can encompass into spirituality, but spirituality will not so much go into religion, okay? Because religion's more of a system of worship. I just want y'all to understand the difference. So spiritual health. So we kind of talked about that already a little bit. To have spiritual health, you need to find that balance, and you need to seek out life-sustaining and life-enriching options, and that occurs by choices that you make. And so you really need to know that to have the spiritual balance, you need to know, to have spiritual health, what the patient is thinking about, what are they planning, and that all comes in with the plan of care, right, which we'll talk about in a few minutes. So you want to know if they have prayers or meditation, if they believe in just that higher being, if they do fasting, if they study, worship, if they do studying, if they're reading books, if that's whatever their practice may be. Okay, so it nurtures and it gives meaning and awareness to have spiritual health. It gives a positive outlook on everything, on whatever's going on with the patient, and it can give them a balance of their goals and their beliefs. And that comes in with their culture too, so it kind of interrelates itself. Where spiritual distress is the disturbance. They usually say they lack hope, they lack anger, they're mad, they're angry. And can you have both? They lose their faith. Can you have both? Spiritual health and distress? Yes, tell you a story. My cousin had breast cancer. She had a lot of spiritual health. It wasn't a big deal. All cancer is a big deal, but it wasn't as detrimental as some breast cancers. Caught it early, had radiation, had a little bit of chemo. Everything was fine. She was like in her late 20s. She's 60 now. When she was in her late 40s, it came back. Okay, and so she had a lot of spiritual distress. She was down on herself. She had lost faith. She had lost hope. She didn't have anybody. You know, her husband and her were divorced at this point in her life. She was real distressed. She had a lot of anger. She blamed God because things weren't going right. And then through family and friends and her daughters, she gained spiritual health again. So that's an example of how you can have both. Can it happen in a hospital over a day or two? Yeah, it can. One day they can be distressed, and one day they can have spiritual health. Ms. John? No! Come. Okay, yeah, and it kind of relates with this too. And then also for spiritual health, I want to bring up one thing. When you have spiritual health, you have a lot of hope and faith, right? People usually have faith, they have hope, and then they have people to have guidance. Well, the same thing, they lose their hope, they lose their faith. They feel like they're all alone. Even they could be in a room full of people, but they feel like they're all alone. And they can go into depression. So really serious things can happen, because when all these snowball effect happens with spiritual distress, what happens to the body? We think about what happens to the body. It weakens, right? They don't want to eat. That's nutrition, right? They don't want to drink. That's fluids. You know, the body starts to really kind of dissipate a little bit, you know, because of their mental needs. You know, when someone's depressed or they mentally do not want to do anything, they don't want to eat, drink, they don't want to take care of themselves. What about their hygiene? That goes down to everything. And so now you know, y'all already learned, brushing your teeth can make you feel better. It helps. It decreases infection. So just think about that. You know, washing your hair, getting in the shower. People don't want to do any of that. Even if you ever work in home health, you're going to find a lot of that, a lot of disparities, a lot of spiritual distress. But how can you enhance their spiritual health, do you think? If you work in a home health setting, and you go in and you find out, you know, you have an elderly patient, they may just have some cardio problems, but they can't get around like they used to. They can't breathe as well, they can't do the ADLs as much, and they can't brush their teeth, wash their hair, get up. They can't even cook for themselves. They're losing what? What are they losing? All their independence, right? So they become depressed, okay? And they used to pray all the time, and then you go over there and you notice week number 4, they stopped doing all that because they found they just sitting around watching TV. I've seen people like this. These are examples. I don't just pull this out of my head. These are examples that I've seen, I've heard about, right? So what can you do to help them? If you go in there, encourage them. Maybe sit down time, you know. Time is a big deal because this isn't a physical thing. This is more a mental thing. Spiritual, health, distress, things that interrelate with culture, with all this. It's all more mental, a subjective thing. By talking to them and speaking to them, finding out what their needs are, finding out they used to pray every morning, now they've lost that too, they don't pray. Well, maybe we need to get them back into prayer. Maybe you need to get them back into meditation or whatever, listening to whatever little sermon or whatever on the TV that they enjoy. They can't go to church anymore. But maybe you can get someone to pick them up for church. It might not be every week, might not be on a Sunday, but it might be during the week. Then you get social worker involved and other healthcare providers. So they can come in and they can become more, they can feel better about themselves, and then their health and wellness will, you know, increase, and then their spiritual wellness will come back in. Their spiritual health, okay? So it's a lot to think about, right? Uh-huh. Right. 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 Uh-huh. Right. Right. That's wonderful, though. That's good, because that's what I did for my aunt. Yeah, it makes them feel better. And then it gives them some hope, right, and faith, and it all builds up again to spiritual health. Also, it doesn't have to be a preacher or a clergy or a minister. It could be something where I know somebody that does really seriously into yoga, not my daughter-in-law, somebody else, but they're into yoga, and she's really into it. And she's in, they're into yoga, and they do a lot of meditation, and they have their friends, 2 friends. There's 3 girls, and all 3 of them kind of interrelate together, and they have a little prayer, meditation, and their own little prayers and stuff. So it could be somebody like that, it could be anything. So it could be just somebody of a higher, something that they look up to, in other words. So religious practices you should know. So these are just some things, holy days, these are religious observations. We have Easter coming up. With Easter, right before Easter, I'm Catholic, we have Lent. On Fridays we don't eat meat. We have Good Friday. I know as people who are not Catholic, all they think of is Good Friday. They can be off of work. But but no, there's a reason why we have this, but we have sacred symbols, writings, jewelry, different things they wear, different things they hold. What happens if they have medals? Have you ever seen a patient have a medal on their gown? They may have a medal. So what happens if they have this medal and they go to they have to go to surgery because they want to wear this medal to surgery, or they want to have the rosaries in their hands? What would you do? Well, you could take it, so you're going to document that they have it, right? And then after they leave, you're going to let them know in surgery, and then they will take it from them and give it to the caregiver or who's ever caring for them and put it underneath or whatever. So because lots of them believe that if they don't hold on that last minute, something bad is going to happen. I've seen it happen. I've heard it happen, So prayer, meditation, medals, beliefs. What about diet? How important is diet? You go into a patient's room and you look and you see they're not eating they're not eating their lunch, they're not eating their breakfast. What's going on? Well, maybe they can't eat this. It's Friday. They can't eat their meat. Or maybe they can't have any milk. Maybe it's against their religion to drink milk on a Monday or whatever. So you need to find out. So you need to communicate, okay? So, and you need to modify their diet.
You mentioned about the symbols and like jewelry or
Mm-hmm.
stuff. If your patient has that, make sure you remove it off the gown in case of like a bed bath.
Right.
Make sure
Yeah.
you put it back, because if you just stitch it into the
Right.
bag,
Right.
then they might think that it's because of that.
Oh, yeah, that's true. Just like dentures, they get rolled up and thrown away. Yeah. So, illness and health, they may feel that because they're ill, they sinned, they punished. Just like we talked about with the magico-religious illness, that they did something wrong, and that's why they're being punished because they sinned or something, and now they're ill. Birth and death, assist fulfilling obligations. A lot of people have rituals, you guys, with births and deaths, and Ms. Strength will get into more of that with grief and loss. I won't go into that. So here we go. We talked about this, spiritual care or spiritual nursing care. So the nurse does not try to resolve patients' spiritual problems, right? We don't try to solve their problems. We listen to them. We offer support. We listen to what they want, what they need, what are their expectations. And we appreciate their uniqueness of how they are and who they are. And then we offer a balance to them of what we can and we can do to offer spiritual care. And then this is just about awareness. We've already talked about this, that nurses cannot hear, respond to patients' spiritual needs unless they hear and respond to their own need. Just like culture, knowing your culture, knowing your own self-awareness, your attitude, your beliefs, same with spiritual. You need to know how you feel about your spiritual self. Just because you do not pray doesn't mean that you're going to go into a room or encounter a patient that prays, and where they may say, can you stand here with us while we pray? Okay? Or they may say, could you please close the door? So if they're praying and you see them and they're praying, you might want to walk out, close the door quietly, and come back and do whatever you need to do. But if they ask you to stay, stay. Just because you don't believe to say this particular prayer, I might walk in and they may, it might be something, Jewish prayer or something. But I'm going to respect their wishes and stay there with them. It makes you feel good, I tell you. It makes you feel like you're really a part of that patient's care. And they like it too. They feel that way. They feel the same way. So it's essential that you address the fears of your patient, of course, and respond to appropriately to their care, to help them with their care. Let's see. So now we're going to do some management. So let's see. So I already said this, that spirituality can't be handled like a physical condition or diagnosis. That we're generalists, We're going to listen. If we need somebody to help us along with the spirituality and spiritual experts, as chaplains, clergymen, and spiritual mentors, and then caregivers and friends and family. And never assume the knowledge of the client's beliefs. You need to ask. Make sure you always ask and don't assume that they like this or they want this special prayer, they want this special belief. So this isn't a book, but I kind of like this two-tier management approach. So first you're going to ask, you don't assume, like I just said, that they have a certain spiritual belief. So what you're going to do, does the patient accept spiritual reality? Well, you'll know by communicating and talking with them. And then from there, if they do, then you're going to find out what their beliefs and practices are. What support would they like from you or from the family? Like Ms. Strength said earlier, it may not be, they may not have anybody. So you may be the one to help them with their spiritual needs. You may be the one to stand in there and just listen, stand right there while they say the morning prayer. Or you may be the one to make sure that the clergy person comes in, gives them communion or spiritual or pray or whatever the case may be. Or make sure their friend shows up to pray with them. Okay? Then here's some different diagnoses you have. So you have spiritual and religious distress. It can cause fear, chronic low self-esteem, insomnia. Lots of times, decisional conflict, ineffective coping is something you're going to use when you do a plan of care for spirituality. If you have someone who has ineffective coping, you want to support their practices. When you plan, it's okay, and it's what they would like, and you incorporate their health decisions. You also want to promote hope, and we talked about hope, peace, faith into their plan of care. And it'll be something that you mutually agree on. Remember when you do planning of care, y'all have done this already, right? And y'all have talked to your patient, you decided what you're going to plan for them to do, right? You have done plan of cares? Yes, Ms. Lieber. Yes? Okay. And he provides the spiritual resources, anything that you could do that's available. If someone has ineffective coping because of spirituality, you might want to incorporate that. Someone comes in and speaks to them and does an assessment. You might want a social worker in there, and then you might want to have the priest or the clergyman or something, and then they may want you to be in there while they're talking. So whatever the case may be, whatever their needs are and what their wants are is what you have to satisfy. Then you're going to implement that. You're going to have the clergyman in there. You're going to have the person in there to give them support their religious practices, whatever it is, like praying, whatever. And then you're going to assist the patient with prayer, ask the patient to pray, refer patients to spiritual counseling. There's all different types of resources. You just have to dig in and find them. You have to take the time to be able to just go in there. It takes you 5 minutes to find out. Most hospitals have all these resources and referrals, and all you have to do usually is ask social worker, and they have a whole list. And then you can go offer it to your plan. Part of the care of implementation is going in there and ask them, what, exactly would you like? This is what we have to offer. What is your choices? And then from there, you go from there and make sure that they come in and you implement that into their care. And then we're going to do our evaluation as always. How can spiritual well-being be enhanced? What were the patient's outcomes? Remember how we're doing right now, which y'all been doing as far as looking back at that outcome. Once again, just like I talked about with culture, looking at your goals. Did you satisfy them? Did you not? If not, they were not met, you need to change them up a little bit, right? If they were met, you can move on and you can continue with this plan of care and continue on. If, say, for example, if it's you got a clergyman in there and they're coming in every morning to do a prayer, or a friend to come in and pray every morning and every evening, just continue when you're there as a nurse, make sure that they're still doing that, okay? And evaluate any other goals that you may have with them to move on to help with their spiritual health and wellness, okay? So that's it. If y'all have any questions about spirituality or the needs for your patients, has anybody yet done anything like my student earlier prayed? Anybody prayed with your patient yet, or no, not yet? Anybody had them in there just asking? No, nothing.
The only thing that I had, one of my patients insisted with that heart
Uh-huh.
and when I walked in, first thing he did was give me a hug.
Oh, okay.